You're welcome to A to Z Health Check with Nurse Coach Ola. So, as I promised, I'm going to be sharing health conditions, details about health conditions, and how to manage them. I'm going to be working with other people as well, sharing experiences and referring people as well to experts and specialists when it comes to your health. So today, just want to talk about blood pressure, high blood pressure, and how to measure the blood pressure. As you can see, this is a blood pressure monitoring machine. High blood pressure, like we know, or hypertension, is a major risk factor for heart disease and stroke. So if you have been diagnosed with high blood pressure either recently or a long time, you know that your blood pressure needs to be checked and monitored regularly. So today I'm just going to show us how to monitor our blood pressure and why it's important to monitor our blood pressure, and what are the basic things you need to put into consideration when it comes to monitoring your blood pressure. So as we all know, like I said, high blood pressure is a major risk factor for heart diseases and stroke. So many people, we've had instances of people just dying, having stroke. Just like that, this starts somewhere. Definitely start from maybe when the blood pressure is not treated properly, and you can't treat what you don't monitor. So you need to be able to monitor your blood pressure, so you and your doctor will be able to manage it appropriately. So a poorly managed blood pressure will lead to heart disease, will lead to stroke, will lead to renal damage, and so on and so forth. So it is important that you take care of your blood pressure. Now let's see how we can monitor the blood pressure using the blood pressure machine. What should you take into cognizance? So a good time to check your blood pressure is first thing in the morning, and then again in the evening, about 12 hours apart. Usually we take two numbers are used to measure your blood pressure. One number records the blood pressure, which is at the top, called the systolic pressure, and then we have the diastolic pressure, which is the number at the bottom. Okay, so the normal level of the blood pressure is usually 120 systolic over 80 diastolic. If you have been told that your blood pressure is 140 and over 90 or higher by your doctor, you should discuss this with your family doctor. You should discuss it with your GP as well. So if you've checked your blood pressure, or you've gone to anywhere and you've checked your blood pressure and it's over 140, please visit your doctor or your physician. Okay, I mentioned the good time to check the blood pressure. So how do we measure the blood pressure? Before you measure your blood pressure, make sure that you avoid caffeine, exercise, and smoking for at least 30 minutes before checking your blood pressure, if you take all this. Okay, so it's important that you sit comfortably for 5 minutes prior to checking your blood pressure. So if you have gone for an exercise or something, make sure that you take the time to rest. Sit comfortably for 5 minutes prior to checking your blood pressure. Sit with your back supported. Okay, sit with your back supported, your legs uncrossed and feet flat on the floor. Stay relaxed and avoid talking during the BP check. Relax your arm. Alright, so it's also important that you remove any tight clothing on the upper arm. It's best to have your arm bare. Okay, so remove any tight clothing. Rest your arm on the table at the level of your heart. So you see, rest your arm on the table at the level of your heart with your palms upward. Can you see mine? With your palms upward. Then place the cuff appropriately around your upper arm. So I'm going to place this there right now. Okay. So it's also important that you get the cuff that fits perfectly to your upper arm. So there are different sizes to this cuff, so you should get a size that is appropriate to you. Okay, so that is it. So you need to use the correct cuff size to obtain the accurate result. The cuff should fit snugly but not too tight. The cuff will tighten around your arm and then it will release once you press. So this is the machine. I'm going to press the start button. Okay, so after checking the first, it's good that you take a rest within 15 minutes. Take note of the recording and put it down. 10770. Put it down. You should have a journal that you use to record your blood pressure. So put it down the first reading. After 5 minutes, could go again and do this. Also, always good to do these two check-ins. Okay, so you can find an average. So go again after 5 minutes and do the same thing over. All right, so after this, then you should make sure that you report your blood pressure findings to your doctor. If there is any discrepancy, make sure that you check again. And like I said, it's good to check in the morning and then in the evening, 12 hours apart. So if you need any further information on how you can check your blood pressure, or if you have any issues with your blood pressure, please feel free to send me a message. And then we can talk about, we can book a consultation with Nurse Kushola and we can talk about this. If you want to purchase your blood pressure machine, you can visit Prima Proper Medicus to order for yours. There are so many other outlets there that you can get it, but Prima Proper Medicus also have this in stock. There are different blood pressure machines that you can use, maybe the wrist, the arm, depending on you, and you can always get this. Most importantly, know that high blood pressure that is not controlled can be a great risk, causing heart diseases and stroke and so many other damages. So get your blood pressure checked. See you later. So people asking about the usefulness of home blood pressure monitoring. So home blood pressure monitoring may be especially useful for anyone diagnosed with high blood pressure, hypertension as it's called, or individuals starting high blood pressure treatment to determine its efficiency. So, or people requiring closer monitoring, especially individuals that have high risk of high blood pressure, and your doctors have said you need to continuously monitor your blood pressure. So rather than going to the hospital every now and then, you could actually do home blood pressure monitoring. Pregnant women experiencing pregnancy-induced hypertension and or preeclampsia are also recommended to have home blood pressure monitoring. Okay. For instance, if you have been noted maybe to have any heart disease or anything relating to the heart, so your blood pressure is also important that you check. The other question I'm going to answering about blood pressure monitoring is it to use the left arm or the right arm? So several studies have been done to determine what is the normal variation actually. So in general, any difference of 10 millimeter mercury is considered normal. So whether you're using the left or the right hand, there are no basic significant difference. So just make sure that you are consistent in whichever one that you're using. If you're using the left hand, people say, oh, because it's closer to the heart, it gives a better reading. So just make sure that you are consistent. Why is it important to keep a blood pressure journal? So generally, one blood pressure measurement is like a snapshot shot. So it tells you what your blood pressure is at the moment. If you keep record over a period of time, it provides that time-lapse picture. You can manage, you can see how is your blood pressure over time, and then you can be able to seek help accordingly. And it also helps your physician or anyone managing you to know the pattern of your blood pressure. Is usually high in the morning or is usually low in the evening and things like that. Another question that I've been asked is about which is better. Is it the wrist of finger monitors or the calf monitor and things like that, or the one for the arm? So wrist and finger monitors are not recommended according to the American Heart Association. Okay, they are not recommended because they yield less variable or reliable readings. Okay, that doesn't mean that they are not efficient, but it's not just usually recommended. So you should choose a monitor that has been validated. If you are not sure, please ask your doctor or pharmacist or your healthcare provider for advice about this. When you are selecting your blood pressure monitor as well, especially for older people, pregnant women, make sure that these things they are validated. And it's also important that you bring your blood pressure monitor to your next hospital visit so that your doctor could check, to check what kind of monitor are you using. Make sure that your core fits properly. When you measure around your upper arm, it will help you to choose a monitor that comes with the correct size core. Okay. And so that's the bit about my question. If you have any other question regarding monitoring your blood pressure, feel free to send me a message or drop it in the comment section. Again, this is Nurse Koshola, A to Z Health Check. Take care.